All right, so good morning again, and welcome to Illinois Children's Healthcare Foundation 20th Anniversary RFP info session supporting a strong children's health workforce. I am your facilitator, Santrice Martin, the Chief Operating Officer of Illinois Children's Healthcare Foundation, and I'm joined by my colleagues, Heather Alderman, the President and CEO, Christine Brambila, our Senior Program Officer, Children's Mental Health, Bob Egan, our Senior Program Officer of Children's Oral Health, Dakota Dukes, our Administrative Assistant, and Nedrine Hunt, our Grants Manager. The purpose of today's info session is to provide an overview of the RFP and to answer your questions. With that said, we want to remind all that this RFP is seeking creative ideas that educate and inspire young people to join the children's behavioral and/or oral health workforce. Therefore, I want to just make clear that we have received several questions regarding an idea and/or initiative that would fall within being creative and/or inspirational. And what we want to just let you all know that today we will not be providing opinions on whether or not your initiative fits the narrative. However, we want to hear directly from you all as you complete your RFP. Ideas that you think best resonate for your community, understanding that you have much better insight in terms of what works well for your community. And so we will not provide our opinion, rather than we want to learn from you all what works best for your community. Please know that this session is being recorded and it will be live, or it will be available on our website within a timely manner. So if at any point you want to go and revisit what is discussed today, feel free to check our website at ILCHF.org and you'll be able to find the video there. Before we get started with our presentation, we want to get a sense of who's on the recording or who's on in our webinar today. So we have two polls that we want to launch. We want to launch the first poll, getting a sense of whether or not you've been previously funded by the Illinois Children's Healthcare Foundation. So at this point, we're going to launch poll number one. Dakota, can you launch poll number one? Okay, and at this point we have I think we have all of our responses in, and so we are going to end the poll at this point and then just share with you all the results. And so currently we have approximately 41% of you who have been funded, and then 59% of you who are new to our foundation. So again, thank you all for participating in that poll. It just gives us a sense of whom we're talking to today. And then there's one additional question we want to ask you all as well. And it's just to get a sense of what area of focus are you considering applying for. So we're going to launch poll number 2. And if you can share with us if you're going to apply for the behavioral health and/or the oral health, or both aspects of this RFP application. Okay, and I think everyone has completed the poll. So we will end the poll at this time, and we'll share the results with you. So it looks like there's going to be about 63% of you applying as it relates to the behavioral health aspect, 19% of you applying as it relates to oral health, and then a combination of both, there's 19% of you all. Again, thank you so much for participating in this poll. And as I mentioned earlier, it gives us insight in terms of who's out there, what you're thinking about, and what we can expect to receive as it relates to the applications. So at that point, we're going to close out our results. Oh, sorry, close out this section of the poll. And we are going to move on to the presentation. So we will turn over the presentation to Christine and Bob, who will provide an overview of the foundation, the RFP, and the application process. So I am turning it over to you now, Christine.
Thank you so much, Santrice, for that warm introduction, and thank you all for being here today. We know that you have competing priorities, and we're so excited that you're here to join us to learn a little bit more about this RFP. Next slide, please. So as we get the slides back up, we just wanted to briefly review the agenda with you today. So part of the agenda will include an overview of the Illinois Children's Healthcare Foundation. Then we'll also be discussing the RFP overview of supporting a strong children's health workforce. We will then explore the application process and go over some more technical parts of the application process, and also spend a significant amount of time discussing some of the questions and answers. So with that, next slide, we'll dive right into the content about the history of the foundation. The Illinois Children's Healthcare Foundation was created in December 2002 through an action of then Attorney General Jim Ryan and an Illinois insurance carrier. The action and a settlement of approximately $125 million established Illinois' only private foundation focused solely on the health needs of children across the state. Since 2004, 760 total grants have been awarded for a total of $131 million. Next slide, please. And as we review the mission of the organization, our goal is to cultivate, support, and promote initiatives that improve the health and wellness of children in Illinois, recognizing that the vision is that every child in Illinois grow up healthy. Working with grantee partners across the state, the foundation focuses its grant making on identifying and funding solutions in the barriers that prevent children from accessing the ongoing healthcare needs, with the primary focus on children's oral health and children's mental health. The foundation's philosophy is that healthcare must address the whole child, and that a healthcare system in Illinois must be responsive to the needs of all children. Next slide, please. Over the past couple of years, Illinois Children's Healthcare Foundation has partnered with Common Health Action to devise tangible strategies that institutionalize equity, diversity, and inclusion across the organizational policies, programs, and practices. This partnership resulted in an equity, diversity, and inclusion action plan outlining 6 domains, including accountability, governance, grant making, talent and organizational structure, training and education, and vendor and consultant diversity, in which the foundation can focus energy, efforts to successfully integrate equity, diversity, and inclusion throughout its policies, programs, practices, and culture. Each area of focus is further broken down into 4 objective areas of transparency, accountability, shared decision-making, and knowledge sharing. This information session promotes transparency into the grant-making process here at the foundation. Next slide, please. As we explore our current grant making, the ILCHF allocates approximately $5 million per year towards children's mental health and children's oral health and unmet emerging needs. So you'll see roughly about the breakdown, about half and half of children's mental health and children's oral health, and then about $500,000 that's dedicated towards unmet and emerging needs. Currently, in our grant making process, we're at the pre-award stage in which we're collecting applications from you all. And so we review the application once May 16th comes around. We'll be reviewing the application and downloading the submission of the applications. Then we will announce the awards in a letter. We'll complete required paperwork and process grant payment. And you'll hear from our team members, our grant manager, Nedjani Hunt. And then after the award, there is the opportunity to access technical assistance as needed and the final report submission. One important question that we also received ahead of the webinar was about who are the decision-making partners. And so when it comes to reviewing the applications, they're reviewed by staff utilizing a rubric, and recommendations of proposals to move forward are then submitted to the grants committee for review. Next, they will be advanced to the board of directors for final approval. So with that, we can transition to the next slide. And this map is helpful. We are a statewide grant giving organization, and we have divided the state of Illinois into 7 regions. And we will also launch a poll to ask and learn a little bit more about you all, what areas of the state you're representing. And you could see the various areas of the state that are color coded. We have collar counties, East Central, Metro Chicago, Northern, Northwest Central, Southern, and Southwest Central. Dakota, can you launch the poll, please? Thank you. And we'll take just under a minute to review what region of the state that you represent. And there's also an additional option for multiple sites, or if your organization is statewide. All right. And as we could see, the vast majority of participants represent the Metro Chicago area with about 43% representation. And then we have a mix of about 13% from collar counties, 9% from East Central, 11% from Southern Illinois, and about 9% from Northwest Central. This is important information as we continue to think about where we allocate and where we prioritize efforts to recruit new grantees and partners across the state of Illinois, and where we can enhance our geographic diversity in our grant making processes. Thank you, Dakota. So with that, I want to transition it to my colleague, Bob, who will discuss a little bit more about the why behind the RFP process. Bob?
Thank you, Christine, and good morning to everyone. Thank you for being here. Next slide, please. So I'm going to talk a little bit about and providing an overview of the Supporting a Strong Children's Health Workforce RFP and the various components in the application. So as the foundation moves into its 21st year of collaborating with grantee partners, the Board of Directors has approved the Illinois Children's Healthcare Foundation 20th Anniversary Grant Opportunity, Supporting a Strong Children's Health Workforce in Illinois. This funding opportunity will provide 21 geographically diverse grants of up to $20,000 each for strategies that encourage and nurture the next generation of oral health and mental health care providers. The foundation hopes to award 3 grants in each of the 7 geographic areas that Christine covered. Next slide, please. So why workforce? For over 20 years, the foundation has been privileged to travel the state to meet and celebrate and collaborate with people and organizations and communities working to improve health outcomes for Illinois children. Through the work of partners across the state, there's much to celebrate. Thousands of children have received the quality health care needed to help them live healthy lives. But even with all these successes, there's still much work to be done. One overwhelming challenge that impacts all areas of children's healthcare is related to the children's healthcare workforce shortage in Illinois. The foundation has listened to stories of workforce shortage areas across Illinois, sought data specific to communities in Illinois, and learned about innovative programs to help alleviate these shortages. Next slide, please. The goal of the project is to provide learning opportunities and guidance to youth as early as grammar school to allow the exploration of potentially developing a career path in healthcare. Possible projects might include developing new partnerships between health training programs and schools, develop and or expand existing mentoring programs, and or develop healthcare career shadowing programs in the focus area of children's oral health and children's mental health. An example includes a school counselor developing a program that arranges for representatives from various medical professions to speak with children on a quarterly basis. There are many ways to think about this application, and we encourage creativity and innovation. This grant opportunity is available to nonprofit organizations that have the capacity to help children learn more about careers in health care. These ones can be used to seed new programs or expand existing ones. Preference may be given to organizations serving historically underrepresented youth populations and professional healthcare workforce shortage areas that demonstrate the ability to sustain programming past the grant period and share replicable models that may inspire youth in these areas. Next slide, please. The foundation is on a journey to learn, understand, and embed the concepts of equity, diversity, and inclusion more intentionally into our work. As part of our learning, we're seeking to have a deeper understanding of the approach our grantees are taking regarding equity, diversity, and inclusion, and about the diversity of the staff and leaderships of organizations that we fund. The foundation values board, management, staff diversity among its grantees that is reflective of and or representative of the people they are serving. The foundation recognizes that diversity is expressed in different ways, including race, gender, religion, ability, economic status, sexual orientation, language, national origin, and age. Collecting this data will help us have a deeper understanding of and help us to learn from the organizations that apply for funding. The information will inform, but not be determinative of an applicant's success. Next slide, please. So to provide a little information about the program narrative, we are asking in 1,000 words or less, simply for you to let us know how you would use up to $20,000 within 18 months to support youth interested in healthcare service careers within the fields of children's oral health and or mental health. Next slide, please. So a little bit about the budget and financial information. So we're requiring you to submit a budget. On this slide are some examples of eligible costs that you can apply for. Staff to develop or administer the program, stipends for speakers, travel time, meeting expenses, communication expenses, materials, supplies, incentives for schools, for students, or equipment. We're also asking that you include as attachments some financial documents. If applicable, we're asking you to submit your IRS Form 990 and your Illinois AG 990. And we understand that some organizations are not required to file those documents, but if you are, we do require them. We're asking for your most recent audited financial statements and also an IRS letter of determination indicating that you are a nonprofit organization. We're also requiring a budget narrative with your application, and we're asking you to delineate details associated within the budget. So for every budget line item that you're requesting funds for, an explanation as to how those are going to be used. We ask that you clarify the calculations leading to the budget numbers and provide additional budget details that may not fit within the budget template. Next slide, please. So with regard to the announcements, the grant recipients will be announced at the Foundation's 20th anniversary luncheon, which is going to be held on September 21st, 2023. And the luncheon will be held in Oak Brook. Recipients do not need to be present to receive a grant. Grant funds will be distributed no later than December 31st, 2023. And grant payments, it will be one grant payment for the entire amount. The grant period will be January 1st, 2024 to June 30th, 2025 to accommodate for various partners. We are mindful that these grants will likely be implemented either in partnership with schools or consistent with the school calendar. In order to provide a full school year, August of 2024 to June of 2025, to implement any proposed programs, grantees will have until June 30th of 2025 to complete their projects and spend their grant funds. Next slide, please. And these are some important dates associated with the RFPs, some of which we've already covered. If you have general questions or questions about oral health, please feel free to email me. My email address is on the screen, bobegan@ilchf.org. Be happy to discuss any questions that you might have. We launched the application on March 14th of 2023. And today we're holding the informational and technical assistance webinar. And as Santrice mentioned, it'll also be posted on our website. The closing date for the RFP is May 16th of 2023. And as I mentioned, the award date will be September 21st, 2023. Again, the grant period being January 1st, 2024 through June 30th of 2025. We're anticipating to have 21 awards. Each award, again, up to $20,000. And the total amount available for the RFP is $420,000. On the slide is our website, ilchf.org. Again, we will have this webinar posted, and we have all the information details of the RFP and how to get started. And with that, I'm going to hand it back over to Christine.
Thank you, Bob. And now let's dive into a bit more of the technical aspects of the application process. Next slide, please. Now, prior to accessing the application, the online portal, you need your organization's employer identification number, which is available on your most recent IRS Form 990 or IRS determination letter. Next slide, please. Some of the core components of the application that we will ask you about include organizational information, such as your mission statement, and a brief synopsis of the work overall of your organization. Next, as Bob mentioned, we are on a journey and we want to understand a little bit more about our grant making and our grant partners and learn more about the diversity of their leadership and staff, as well as their board membership. We also want to understand a little bit more about your community as identified as what is your service area? Is it within a specific community area? Is it a specific neighborhood? Is it a county? Is it across multiple counties? And we also want to understand your population served. This will also help us understand the context of your localized community, with which we use to also explore the context and evaluate your project narrative, and also explore and understand a little bit more about your budget and financial information. Next slide, please. Now, as we walk through the screen grab, some of you may already be familiar with this webpage, as you may have already started your application or accessed the web portal. But if not, I wanted to take a moment, especially since we have so many new individuals that haven't previously received funding from our organization. So I just wanted to take a moment to walk through what are some of the screen grabs that you might see. So once you visit the website, ilchf.org, you'll see at the top banner, grantees and applications. And the second option, as indicated by the dark blue arrow, is the open RFPs. You will then be directed to supporting a strong children's health workforce in Illinois RFP. And that web page will give you a couple of links in which you can access information. And then in the lower half of the page, you'll see the link to access the online application and the opportunity to click here. Next slide, please. So once you access the portal, you will be prompted to create a login information. So we will ask for your email address as well as creating a password. If you're a new applicant, you have that opportunity to set up your password and login information. And then once you access that information, you'll be directed to the next screen that will ask you to enter your tax ID information. And this is how we ensure that one applicant is the lead per an organization, and we can de-identify if you have multiple sites. With that being said, only one person can be the lead for an organization. So 5 people can't contribute to the same application. Only one person can be entering information in our online portal. And once that information is entered, you will see the screen in which you will, next please. And then you'll get access to the online application portal. As you can see at the top, I know it is super small, so I apologize ahead of time, but you'll see that there are a couple of tabs for you to navigate and for you to enter various information on the web page. There is an opportunity for you to save and continue working on it later. If you need additional information, you need to check in with your CFO or finances, you need to check in with your executive director or the project manager so that you can also save and continue the work at a later date. And then you'll also be able to review the total submission. If there's any errors, you'll get a little red asterisk that'll indicate where you need to enter the correct information moving forward. And just a reminder that only one person can access the application for your organization, and you can save and finish your information at a later time should you need to double check on something. Next slide, please. And as Bob mentioned, we're only the reporting requirement after the award has been granted is a final report. And some of the information that we're collecting from you is similar to the information that you submitted during the application process, including organizational name, total children served, total hours of engagement, and a little bit more about how the grant funds were expended to support and engage youth interested in healthcare services. And then in updated information about the budget and how you were able to spend down some of the funds that aligned with some of our allowable expenses. And then we also wanted to hear from you, what are some of the outcomes that you've been able to achieve as a result of the grant funded activities. And you'll see a lot of alignment between the questions we ask you during the grant application process and what we would like to hear from you at the end of the final report of the RFP. So with that, next slide, please. And this is also an opportunity to discuss and to learn more about some of our, where you can go for additional technical assistance should you become stumped at any part of the process. So next slide, please. So again, we're here to help you. We want to succeed and support you in submitting the best application possible for on behalf of your organization. So our information address and contact information for the foundation is listed above. And if you have questions about children's mental health, feel free to contact me, Christine Brambila. My email is included on the slide. Again, as Bob mentioned, if you have general questions about the RFP, or if you have a specific question about children's oral health, you may contact Bob. And if you have technical questions related to the RFP, please contact our grants manager, Nedrine Hunt, and her email is also included at the bottom of the slide as well. And with that, I turn it back over to Santrice.
Great. So again, we want to thank you all for participating in this info session and expressing interest and helping us play a small role in addressing the healthcare workforce issue that we are seeing within our state. So at this time, what we want to do is open it up for questions. We are going to start with the questions that we received during the registration process. And then we will work through the questions through the chat. So again, if you have any questions, please place them in the chat and Dakota will be fielding the questions for us. And we will do our best to answer those questions. If we don't have an answer today, we will follow up with you and provide those answers at a later time. So at this moment, I'm going to turn it back over to Christine and Bob so that they can start with the questions that were submitted during the registration process. And again, then we will proceed with the questions in the chat.
Okay, I'll start with a first question that we received. Regarding this RFP, how does foundation define youth up to what age? And we define youth up to the age of 21 and inclusive of 21. So it's anywhere from grammar school through college, I suppose.
Mhm.
Then we had a technical question regarding to creating an account. So the password, so you enter your email, the password must contain at least 12 characters with at least 3 of lowercase, 3 uppercase, 3 numeric, and 3 special. And if you do continue to have problems, please feel free to reach out to my colleague, Ned Renee Hunt, who is well more versed in this than I am.
An additional question from Eventbrite that we received ahead of time stated that many children do not go on to higher education because of systemic family issues. Is the program aimed to inspire children to go into healthcare or to help them create sustainability to allow them to receive higher education? Maybe both. And as a foundation, the goal of the Supporting a Strong Children's Health Workforce grants is to inspire children to pursue careers within the fields of children's behavioral health or children's oral health care fields. And we also understand that both fields are dynamic and there's many opportunities for individuals to enter the pipeline when we understand the breadth and the depth of the types of professions, positions, and certifications that individuals are able to achieve when it comes to accessing and entering the fields of oral health care and children's behavioral health.
Another question we received, what supports, if any, do you offer parents dealing with children facing mental health issues? Again, the focus of the RFP is to inspire children to pursue careers within the fields of children's behavioral health or children's oral health. It is not focused on providing direct supports to families. There's some resources if you need and experiencing a mental health crisis, and we would be happy to provide those to you. Another question is we have a long tradition of delivering a free STEM summer day camp to promote biomedical careers to underrepresented youth in Chicago. If we add dental and behavioral health to this, would this suffice? Again, the purpose of the RFP is seeking creative ideas that educate and inspire young people to join the children's behavioral health and oral health workforce. So therefore, we're not going to advise on whether an idea being considered aligns with the vision. The entire project narrative should embed opportunities to educate or inspire young people to consider oral health or behavioral health careers.
Another question was, will we accept collaborative proposals for this RFP? If so, should the youth programming provider or the mental health services provider trainer be the lead applicant? So for this proposal, collaborative proposals will be considered for the RFP, but the award amount will be limited to $20,000. Only one lead organization could be listed in the grant application, but additional partners can be included in the project narrative.
Great. We also received a question about, I'm interested in developing a peer support program, but I've not found adequate training programs, materials to initiate such a program. Peer mentoring, peer support, guidance on the pros and cons of each would be helpful, as well as guidance on training students. You know, we realize that each organizational partner brings a set of expertise and experience working within your specific community. While there may be standard components of peer mentoring programs, we welcome creative approaches that uplift the strengths of each community for consideration. There is a question about who will be reviewing the RFPs and recommendations for award selection. I believe Christine covered that in her presentation, that staff will be reviewing all applications. We'll be using a rubric based on the application itself. We will be making recommendation to our grants committee, who will also be reviewing proposals and ultimately making recommendations to our board of directors.
And the next question really dives into some of the eligibility questions. How many awards will we be funding? What is the timeline of the grants? And when will awards be announced? And again, this is something that Bob covered in his slide. And there is one slide that has a really good synopsis and summary of some of that key pertinent information. There will be 21 awards of $20,000 across the state of Illinois. And again, as we think about the geographic equity and we think about how we can be equitable in our grant making processes, the state of Illinois is a vast state, and we want to continue to uplift some of the diverse and innovative approaches to cultivating and engaging youth across the state of Illinois. The awards will be announced September 21st in Oak Brook, and grant funds will be dispersed no later than December 31st. And we are mindful that this will be in collaboration or in partnership with schools. So we the funding should be spent down before June 30th, 2025. And there will be a request for a final report and an updated budget at the end of the grant period.
And then we have a question about what types of organizations are eligible. Nonprofit 501c3s. We expect to get a wide range of kinds of applicants, whether it be schools, whether it be providers, whether it be just the whole range of organization supports to children throughout the state of Illinois. And we're looking forward to seeing that kind of diversity in the applications we receive.
And then the next question that I believe has been asked as well, where do potential healthcare workforce persons need to be in their education of training? And again, we're seeking creative ideas that educate and inspire young people to join children's behavioral health and oral healthcare workforce. And young people can be defined as individuals under the age that are 21 or under the age of 21.
And I think the final question that we received ahead of time through Eventbrite is the number of students being served through the grants important in deciding if the grant funds will be given or not? Is research plan needed for this grant, or is it purely service-oriented grant? So the number of children served through this grant will not be a deciding factor in reviewing the grant applications. And it will not be a deciding factor in reviewing the grant applications. Within that grant application, the project narrative will give us a better understanding about the breadth and scope of engagement with youth in the grant application. And a research plan is not required for this grant. We understand that the grant is $20,000, and we want it to be focused on engagement with youth to inspire young people to join children's behavioral health and or oral health care workforce. So I believe that was it for the questions ahead of time. I know we received some questions through the chat.
Right. So great. So thank you, Bob and Christine, for going through those questions. We hope that that has provided a bit more insight in terms of the application process, who may be eligible, how are we defining young people. So hopefully that answered your questions. If not, again, feel free to reach out to us post this webinar and we'll do our best to answer the additional questions. But at this time, we want to walk through the questions that were listed in the chat. So the first question is, what time is the proposal due on May 16th?
I believe we are going to close the RFP at 5 p.m. on May 16th.
So
That's
at
correct.
5, okay, perfect. So at 5 p.m., the proposal will be due on Tuesday, May 16th at 5 p.m. And then the next question, will at least one award be made for each geographic area identified?
Well, the goal is to identify and fund 3 grants per geographic area, per those 7 geographic areas that Christine talked about in her presentation. We know that the state is very large. We know that there are diverse needs throughout the state. And being a statewide foundation, we hope to cover all those areas.
Perfect. The next question is, will the slide deck also be available online? And I can go ahead and say yes. So we will post the video as well as the slide deck to our website, hopefully within the week, if not earlier than that. That will be the plan. The next question is research needed for this grant at all? And I think, Bob, you just answered this question, right?
Right. We're looking for you to, the goal of this RFP is to mentor and encourage youth to join workforce, oral health, mental health. And we realize that the grant amount is $20,000. Anything that you can help use to justify the need or the rationale for this program would be appreciated, but we're not looking for extensive research in association with this RFP.
The next question, is it fine to use funds? Hold on, sorry, another question came in. So then is it fine to use funds to recruit interpreter or bilingual health professionals?
St. Teresa, may I? I think that is a very eligible cost. And yes, I think we would consider that in the proposals to us.
Okay. The next question is, the foundation has grouped youth by different age groups. Are we able to serve young people across age groups? And I think what they're asking is, as you recall, our RFP has certain age groups that you can click on. So the question is, are we able to serve multiple age groups?
I think the answer is absolutely. Yeah, we're looking for your creativity and your innovativeness, and it's open to all age groups. So yes.
Okay. Perfect. The next question, if your organization doesn't have audited financials, is there other financial documents that can be submitted in its place to meet the requirement?
I think that's a question that you could directly email with me, and we can discuss about the reasons for not having an audit. Perhaps it's a very small organization, and we can talk about what financial documents would be acceptable.
Perfect. So for that particular question, if you send Bob an email directly, he will make sure to answer that question directly. Okay, so then the next question is, sorry. Since so many of the applicant organizations are from the city of Chicago, it sounds like the application process will be extremely competitive for us, as only 3 grant awards will be made to our region. Can you discuss the rationale behind that decision? So I'll start and then see if anyone else wants to chime in. But as we mentioned, this is our 20th, we're celebrating our 20th year of impact as it relates to partnering with grantee organizations that focus on improving the mental health and oral health of children and families across the state of Illinois. So our intent with our 20th year was to create 20 grant awards of $20,000. But as we mentioned earlier, we have 7 geographic regions across the state. And so what we thought would be fair and also coincide with going into the 21st year would be to provide grant awards to 3 organizations per region across the state of Illinois, to allow for geographic diversity, as Christine mentioned earlier. So that's the rationale behind the decision. We wanted to make sure that we are, keeping in step with what we've done previously as it relates to our 15th year anniversary. We did something very similar. So for the 20th year, we are again awarding X number of grants, we wanted to also evenly distribute those grants across the state of Illinois and across our regions. So that's how we came to 3 grant awards per region. But I'll pause and see if Christine or Bob wants to add to that response.
If I just may add something to that, Santrice, as we said in our presentation, the foundation over the course of our funding has come to understand the huge need for workforce development strategies. And our foundation does have a particular focus on children's mental health and children's oral health. This is also going to be a learning opportunity for us to find out what is going on and what great, exciting things are going to happen because of the work that you all are doing. I know in the area of oral health, workforce in the next couple of years is going to be a huge focus. So I don't think the funding is going to end here. For the purposes of this opportunity, yes, as Santrice said, we're looking to fund throughout the state since we are a statewide funder. But I think there's always going to be opportunity for workforce development strategies, particularly in children's oral health and children's mental health. And the application itself is relatively short. And again, it will be a huge learning for us. And we want to know what's going on there. We want to know if down the road, additionally, we can help support these kinds of programs because we're in it for the long haul. And this is something that we will continue to do, again, because we know workforce issues are just huge and preventing a lot of exciting things from happening.
Great. Okay. So then the next question, can funding be used to provide stipends or trainings to mental health interns?
I think the only caveat with that would be, are the interns under the age of 21? Because again, the goal is to inspire youth to join the behavioral health or the oral health workforce. So I think it really depends on the age of the interns. But again, the focus is how can we inspire youth? And so stipends might be necessary with regards to after school programming or transportation, or to help inspire or at the completion of the program. But really, we want to be mindful of who are the direct beneficiaries of this program or within the project that you're proposing, and are those individuals under the age of 21?
Mm-hmm. Yeah. And I would just add to, I agree wholeheartedly with Christine. And I think the other thing just to think about too, as it relates to mental health interns, is whether or not they're facilitating a certain aspect of your program that inspires young people to be interested in oral health and or behavioral health careers. And so if they are written in the proposal as a facilitator, as a trainer, et cetera, I would say the funds can be used to provide stipends to be able to do that as well. Okay, next question. Can you expand on what the $500,000 towards unmet emerging needs can be used for, specific to only oral and behavioral health, or can this be towards a program that includes a component of mental health? Great question. Anybody want to start?
I will start. With regard to the money that we allocate towards unmet and emerging needs, it's something that the grants committee and the board constantly and consistently reviews, looks at data, looks at what other areas the foundation could be supporting. In the past, we've done a lot of work with lead-related issues and the impact on children. Again, it's something that the foundation continues to look at, review, whether or not that unmet emerging need may have a component of mental health. Again, it depends on the discussions with the grants committee and the board. So it's kind of an area that we look at and review on a periodic basis.
Yep. And I'll also add, I think one of the other aspects that we find that previously does not fall into mental health or oral health is that we funded food banks across the state of Illinois as it relates to COVID response. And so that's one of those areas as well that does not fall within the oral health and/or mental health space. Next question, is it to educate on careers in general for oral and mental health, or working in the future with children in these careers?
If I understand the question, I think it's a combination or could be both. Again, the goal of the RFP is to inspire youth, varying ages, to go into careers in children's oral health and/or children's mental health. If we start young, hopefully we're building a pipeline of interest in these areas. Mentoring will probably be a big factor in a lot of these programs. I'm not sure I'm really answering that question. I hope I'm kind of getting to the essence of it.
Yeah, and I think one other thing that I'm understanding about this is also understanding the breadth of career options within the fields of oral health and behavioral health. It's not just a dentist or just a psychiatrist, but there's many other paths, and even understanding the educational pathways for how to get there could be something that would be interesting within the different project components.
Perfect. The next question, are education institutions eligible to apply, i.e. colleges or universities? And yes, I think we touched on that earlier. The next question, will the rubric be available for review for applicants during the application process?
So the rubric that we're developing, or has been developed, just very closely matches each of the components of the application. We look at all the questions with regard to the narrative. What are you looking to achieve? What is the need? What is the population of children? We're also looking at the various EDI questions. So I think it's a pretty straightforward rubric that we're using. And I don't believe at this point it's going to be shared as we go forward.
Yes. So, and I'll just add to that. So for this particular RFP, we will not be sharing a rubric because we want to use this opportunity to learn from you all and to learn this new process that we're putting in place. So as we mentioned earlier in the presentation, that we're on this journey of our EDI, our grant making, our transparency, our accountability. And so there's certain aspects of this RFP process that we are providing on the website to be as transparent as possible. And there's other aspects of this process that we are doing our best to learn. So going forward, we're able to best support grantees, partner organizations across the state of Illinois. So, but I will say again, if there are specific questions as relates to the RFP that you have, feel free to reach out to any of us and we will do our best to answer your question. And with that, I want to say this will be our last question because we want to be mindful of time for everyone. So this will be our last question. And then we have 2 additional poll questions we want to launch for you all, and then we'll wrap up right at 11. So the last question is, will the results of the evaluations be used to highlight best practices? And will these best practices be shared with other organizations? Will funded organizations and the foundation meet occasionally to share successes, challenges, etc.? So the first question, will the results of the evaluation be used to highlight best practices? And I'm assuming the evaluations means the final or the year-end report.
Yeah, we don't have a formal evaluation associated with these projects. We understand they're many times grassroots, small initiatives. So there is no formal evaluation. But as Santrice mentioned, we will have the end of the year final report. And yes, our goal is to share best practices, to share successes. Anytime any of these initiatives can be replicated, we will do our best to help in that. We're hoping, we know that there are just wonderful, great ideas out there and great initiatives being planned. And, the more people know about these, I think the better off everyone will be.
Perfect. Okay, so again, we want to thank you all so very much for joining our info session today. Thank you for your interest in learning about how we all can address the healthcare workforce shortage that we are experiencing, and that how we can encourage and inspire the next generation of healthcare leaders. We understand that we cannot do this by ourselves, and so we are inspired by each and every one of you on this webinar today. As you all have committed through various ways your interest in advancing the healthcare roles and opportunities for our young people within the state of Illinois. With that said, we want to launch 2 polls. The first poll is just to get a sense of how this info session may have assisted you in understanding more about the RFP. And so we're going to leave this up for about 30 seconds, and then we'll close it out and launch the next one. The next one will be getting a sense of whether or not you are considering applying for this opportunity. For all the questions that were not answered, we will review all the questions, and we will answer them and respond to you all within the week to each of your questions. So note that even though we did not get to them today, we will make sure that we get to them within a timely manner. So we're going to end poll number 4, Dakota, and if we can launch poll number 5, that would be great. Okay, and then poll number 5, are you planning to submit an application? Are you still undecided, or do you need more information? And again, if you need more information, feel free to reach out to Bob, Christine, Adrene, myself. We're happy to assist you with answering any additional questions. So again, on behalf of the Illinois Children's Healthcare Foundation, we want to thank you all for joining our webinar today. I want to thank each of our excellent team members and presenting, and as well as answering your questions. And again, feel free to reach out if there are any additional questions, but thank you all so much for all that you do to positively impact the health and lives of children and families across the state of Illinois. Thank you all. Have a great rest of your day.